Hello, hi everyone. Dr. Abdullah bin Zubair here, a past researcher from Mayo Clinic, Rochester. Today we have a faculty member from Phoenix Children's Hospital, Dr. Dave Bennett. Hi, Dr. Bennett.
Hey, how you doing?
All good, all good. So, Dr. Bennett, how has your journey been through orthopedic surgery? Can you tell us a little bit about yourself?
Oh yeah, I'm from Arizona, and that's where we're practicing right now. And I grew up here and went to Howard University Medical School in DC, and then I went to University of Arizona for residency, and then I went to University of Utah, just north of us, for fellowship.
So, Dr. Bennett, how was your journey in orthopedic surgery as a faculty member and as a resident and a fellow?
So, other after my training, I started off in New Mexico, came over to Phoenix Children's Hospital about 6 years ago. And then now I work at Mayo Clinic and then Barrow Neurologic as faculty, clinical faculty in the community. So I work for Phoenix Children's Hospital, but and then Creighton and University of Arizona. It's been good.
So, Dr. Bent, do you what do you think that program directors are looking for in applicants for orthopedic surgery?
Um, it's been they've been looking a lot for I think that those are the things that they've been looking for.
Uh,
Really liking it. You know what I mean? Not everyone can like this stuff. We can all make ourselves do it, but liking it, I think, matters.
what do they look for in an applicant in general, like when when, like screening applicants for the residency positions over there?
Yeah, I think those are the big things that they're interested in looking for people who are hard workers, of course, and who are interested and really just love orthopedics and want to make it better and take care of patients.
Okay, so does every applicant they are more into research these days, like the IMGs and the medical graduates, they're publishing a lot of papers. Do you believe that the number of papers matter more or the quality of papers for research in an applicant who is applying for residency?
I would say quality almost almost universally is more important than quantity. And I think that also the topics matter, of course.
So, have you worked with IMGs before and how was your experience with IMGs?
Yeah, a lot actually, and I really enjoy it. Every human's different, like in my mind, I don't really cluster IMGs all as a category. It's so varied, so each person is very different on their own merits. But my experiences have all been good, which is great. My mentor is IMG also, uh, Anthony Kallur out of he and I were partners in New Mexico. So I mean, equal footing, I would say, in terms of just credentials alone, is our view. And then every human's different. I mean, one person might be IMG educated and just amazing, and another would be awful. But the same thing goes for the USMDs, in my opinion.
Okay, so if you were applying today in the math cycle, how would you approach it as a freshly graduated or as an old graduate coming into the residency math cycle for orthopedic surgery?
Um, I think I would do as many rotations as I could at the outside hospitals, like each hospital, and get let them get to know my work ethic, and then I would work as much as I could, see as many patients as I could, Go take initiative in clinics, go in and see patients and present them just as if I'm a resident and work hard and show that I like it. And it's always good to ask questions and talk to people, of course, but I think that really it's more about just showing that, yeah, this is like an intrinsic drive that I have. This isn't something that I need to force myself to do.
So, um, I have seen over the time, like everyone have this saying that orthopedic surgeons have a really great sense of humor, just like yours. That I like when I first read your email when you replied to me once, like you have this persona and this sense of humor, which most of the surgeons really, like even general surgeons and neurosurgeons doesn't have. Like, is it something which is related to orthopedic surgeons that they are really nice by heart and have a great sense of humor?
Yeah, it may be a coping mechanism to some extent, right? This job can be hard, and you can get through it by laughing sometimes, usually at yourself.
So, as an orthopedic surgeon, do you believe that most of the IMGs they don't have the, you can say, privilege of having hands-on clinical rotations, and most of them do observerships in which they shadow a physician? Like those letters or those experiences of an observership, are they good enough to for a program director to actually understand that, hey, this applicant, I can take him into orthopedic surgery?
Yeah, that's hard because the hospital has a lot of say on that. So if you're not allowed to show that you're kind of your initiative, and it's harder for sure, just with an observership without a real rotation. I think it's not impossible, but yeah, of course, it can always be harder.
So, as a faculty member, if you were to interview someone, what is the most important factor you will look into? Like the personal statement? Would it be the scores or would it be the rotations?
I want to see that they're curious, and that they have a drive inside of themselves for this, and not so much a uh, impressive, lengthy ledger of achievements, because all of us kind of have that to some extent. Although, of course, those things help, and certainly in the metric world, that helps a little bit with application screening and things like that. But once you're in an interview, I think it's more important just to connect, show your humanity, and then can change. One of the things I look at is if someone's going to be a good boss for me someday, because it's not always that the applicant is coming through and they're going to just work for you forever. Some people like me don't really want to be in like administrative positions, and so I look for people who might be in those positions someday and think, man, would this be a good person to work for? Because you never know. They're going to be colleagues, right? That's what I say.
So, coming to my last question, like if you were to go back in time and advise your younger self starting residency in orthopedic surgery, what advice would you give to yourself?
Oh, it's hard. The more I know, I think the less likely it would be that I do it, right? I didn't really know how long of a road it was, and that made it a lot easier. Does that make sense? If you don't
Definitely.
know what's going, like if you don't know it's going to be a 5-year residency after med school, then you're more likely to go down, start that med school journey. So I don't know. I don't know that I'd change anything.
Okay. So, like, these days there are some letter of recommendations which are personalized, like a note, and there are standard letter of recommendations as well, which have certain parameters on which they grade a particular student on their rotation.
Yeah.
What letter of recommendation you think is more important applying into residency? for an applicant?
Someone whose name is known will help a lot because people won't read the recommendation letter very much. But if they see that someone they know wrote it, they'll text them. This is just how it really works, I've found, and be like, "Hey, is this person good?"
So, so Dr. Bennett, thank you so much for joining
Because
us today.
the name is recognized.
You're breaking up a bit, Dr. Bennett.
Oh, sorry, you cut out there.
Yep. So I'm saying that while ending this conversation we had, what recommendations would you give an IMG, and what recommendations would you give an American graduate applying into orthopedic surgery this year round?
I think just essentially the things I've kind of already talked about a little bit are the biggest things, and that is just to be curious, make sure that you love orthopedics. Like you really have to love it because it can be hard sometimes, and that'll get you through. Have good coping mechanisms, really good coping mechanisms that are not unhealthy. I think that's important too because the challenge is enormous, and you have to be able to get through it in a way that's not self-destructive and then enjoy the journey. You have to really like taking care of patients, and you have to really want them to get better. And I think that has some interest, has a good reward to it too.
Okay. Thank you so much, Dr. Bennett, for giving us time today and being with us
Yeah,
today.
no problem. Thanks for having me.
Thank you.